Hello, folks. So, what I'm going to do today is just try to describe what a colonoscopy is. It is a very simple procedure. I had one in 2007 due to the fact that I had a lot of pain in my rear. And the doctor said that that was nothing to worry about, just that I couldn't even go out and I was simply start screaming with pain. I needed the bathroom straight away because I had loads of diarrhea. Sometimes I could poo at all. And so I was on a waiting list for 6 months. It was not urgent. And of course, he was right. I mean, it was nothing sinister, nothing malicious. It was just a matter of anxiety, and I was prescribed the right medication for that. Anyway, if you are on a waiting list for a colonoscopy, urgent or not, do not worry about the procedure. It's just piece of cake. I had a very good doctor doing that to me. I did that in Canterbury in the UK. And what is a colonoscopy then? It's an examination to look at the lining of your whole large bowel to see if there are polyps or a cancer within any part of it. By the way, if you do a colonoscopy, then you do not need to do any poo tests for 10 years to check the possibility of having bowel cancer. Thanks God I didn't have anything sinister, as I said, but I did have polyps that were taken out for the biopsy, and that's why they ruled out any sinister ailments. It's a long, flexible tube with a bright light and a tiny camera on the end. It is inserted through your back passage and enables the doctor or nurse to get a clear view of the bowel lining. As I said, in my case, it was the doctor doing that. And he's got to be very careful when he does that because the colon walls, they're very thin, they're very delicate, so it can go through the camera. I mean, the wire they're using, whatever they're using, the cable can go through and damage the colon walls. During the test, if the doctor sees anything that needs further investigation, photographs and samples or biopsies can be taken. Simple polyps can be removed during a colonoscopy, and that's what they did to me. The most important part of preparation is bowel cleaning. When the bowel is cleaned out properly, there is a better chance of seeing the bowel wall clearly to spot any changes. By the way, if they realize that you haven't done that properly when you were at home 2 days before that, 1 day before that, they would just stop the procedure and send you home, that you have to do it all over again. Before having a colonoscopy, you will need to have some kind of bowel preparation to make sure the doctor or nurse can see the bowel lining clearly. The bowel preparation is usually an enema medicine given straight into the back passage on the day of the test. I had sedation. I did not feel a thing. It took about 20, 30 minutes, maybe more. I can't remember. It was such a long time ago, but it was very comfortable. You lay on your left side. They show you what's happening inside through the camera, and there is a screen in front of you. And they were very nice people. Before having a colonoscopy, you may be seen by a specialist nurse or screening practitioner. I didn't have anything. Um, anyway, you should be asked about any medical conditions to make sure it's safe for you to have both the preparation and the test. Bowel preparation usually involves a combination of medicine to drink and a temporary change in your diet. I didn't have that. I just had the medicines to drink, and then it gives you a huge diarrhea and you clean your bowels. So they can see it inside clearly. All right. So once again, you get the biopsy results very soon after. They won't let you go out of the hospital if you had sedation. You cannot go out on your own. I had a friend of mine who was kind enough to fetch me, and it all went very well. So, this is for you who is in a waiting list for a colonoscopy. Just do not worry about it. It could also be a little bit pleasurable, if you will. Good luck to you, folks. Give me the thumbs up if you think this was helpful, and to the next video.